Hi, yes, I'm Carla Basante. I am 54 years old. I'm a multiple sclerosis patient. I'm a breast cancer survivor. I've also had several other health injuries in my life. I basically decided I was going to start using cannabis medicinally when I was starting to get prescribed so many different medications for my MS. And then when I have a symptom from a medication, I would have secondary symptoms. They prescribe another medication, and therefore I started really changing into somebody I really didn't like or didn't know how to take care of while I was a single mother. So here I was raising a child on my own, and I needed to make some changes in regards to my health, so I was more present in my child's life. So because I had already done marijuana recreationally, I decided I'm gonna look it up and see. I know there's medical benefits to it, and next thing you know, I'm learning about the endocannabinoid system and how it works with our body, and also realizing that doctors and nurses and people within the medical industry are not educated on this. And there I am, still getting prescribed all these medicines, decided I'm gonna eliminate them one at a time and having more of an intake of the cannabis. But at that time, we didn't really have it as far as medical cannabis. It was still street cannabis. But then we had the medical marijuana program happen in New Jersey, and I made sure I was part of it from day one. As soon as that happened, I got my card through a series of, you have to have the photo ID, you have to pay a doctor who's in the medical marijuana program. I finally found one after I went to one before, and the nurse wanted to call the police on me because they weren't seeing any more medical marijuana patients, and it was ridiculous, but I was very blessed to find one. And there my journey began, and kept educating myself. And then I found out about Americans for Safe Access. As soon as I started learning about their organization, what they're providing for other organizations with medical information and studies, I wanted to be part of the group. And that's how I became a member of Americans for Safe Access. Other than researching it and educating myself on it, that's how I became part of this wonderful group that has a unity of people from across the country. Doctors, lawyers, nurses, advocates, patients, and here we are with a unified message. One, I believe, is definitely to just completely deregulate, not it needs to be reclassified, declassified, and now I'm rambling because I have so much information going on. So it needs to be not reclassified, declassified. But changes need to be made, and this organization is on the forefront of having these changes being made. One of the things that I stress with everybody, because once I go back home to Jersey, it's a whole new world, that the best thing for everyone to do is educate and don't discriminate, because the thing is, we are segregated, and there's no reason why we should be segregated for a plant that has only benefits that will help so many who are dealing with injuries and illnesses without any harm to the body. It's a healthier alternative, and I am all for it, and I will tell anybody and their mother I'm a medical cannabis patient and I advocate for it.